Welcome to Beasy Trans Systems. We're excited to show you how you can get back to life by transferring safely without lifting and without injury to patients or caregivers. We encourage you to watch to the end of this video, paying close attention to safety guidelines and to read your instruction guide in its entirety. Our transfer systems take practice and may need to work a little differently with each patient, as everyone has different medical and mobility needs. We always recommend using 2 assistants with your first few transfers, going to 1 assistant only when you have your technique down. We also recommend that you transfer independently, only with the advice of your doctor or physical therapist. When you have the hard surface of the board and a hard surface to transfer to, your board may tend to slide on that surface. You may need to use a no-slip pad to keep it from slipping. The no-slip pad is a round piece of rubber that can help your board rest on the surface without sliding around. Place the no-slip pad between the hard surfaces. Test the board to make sure it is resting securely. It is important to use a gait belt with all transfers. Some people call them a transfer belt. This gives the assistant a place to hold the patient while transferring that will not stretch or rip, such as holding onto their clothing may do. The gait belt should be snug to prevent sliding. If you are transferring with our systems, the gait belt should be around the patient's abdomen. Unless they have medical reasons, this will not work for them. You may need to adjust the size for each patient. Be sure not to clip the patient's skin when you fasten the belt, by holding your hand in between the patient and the clip. If you should use the gait belt for something other than transferring with a Beasy transfer system, such as lifting, you may need to put the belt around their chest. Ask your medical team what is safe for each patient. With all transfers, it will help if you can take the arm of the wheelchair and the footrest off in the direction you will be transferring, giving you more space for the board and for the patient's feet. Make sure to lock the brakes whenever you are moving a patient. For safety, while learning how the transfer board works for you, 2 assistants are always recommended for the first few patient transfers. Know your limitations. Make sure you feel secure with your transferring technique before using 1 assistant. We recommend clearance from a physical therapist or doctor for all independent transfers. It is good to practice your technique and do a virtual transfer without the patient before attempting to transfer with a patient. Remove the arm of the wheelchair and foot pedals to give yourself ample room to transfer. Lock the wheelchair brakes. Place the board so that both ends have at least 10 to 12 inches on each surface and check that the board is stable. If either surface is cushioned, you will need to make sure that if the board cushions down, it will not slide off the surface. Set the board where you will transfer and slide the seat back and forth with your hand to make sure there are no obstacles in its way, such as the wheelchair wheel, frame of the car, etc. If the seat is hitting any objects, you may need to reposition the wheelchair at a different angle to solve the issue. Now transfer yourself, or have another person transfer with you. It is good for caregivers to know transferring from the patient's perspective and to work out all bugs before having the patient transfer with you. This allows you to work on your technique without frustrating or tiring out the patient. Talking to the patient about how you will proceed with the transfer will allow them to help you as much as possible and help them feel comfortable with the procedure. Sometimes 1, 2, 3, go will help you to work together and let the patient know what to expect. There should never be more than a 6-inch incline or decline between the surfaces in your transfer. Use of a wheelchair cushion may help level the surfaces. This is important for safety, and will reduce the possibility of injuries. A wheelchair cushion can also help keep the board level instead of rocking on the bars that are in the wheelchair seat. Be sure the wheelchair brakes are locked. The patient should be encouraged to lean as far to one side as possible, while the caregiver rocks the seat gently to help place the board underneath them. It may help if your patient is able to lift their leg or gently cross their leg over the other. You can also use your hand to help lift their bottom to get the board underneath. A soft hug can help the patients tip to one side if they cannot do it on their own. When putting the board underneath the patient, leave a small amount of the seat visible in the direction you will transfer. This allows the patient's body weight to ride on the gliding seat, so the friction is absorbed by the seat and not the patient's skin. It also helps their skin not to overflow in front of the seat so that pinching occurs. If any redness, swelling, or discomfort occurs, discontinue use and check with a healthcare professional. Now you are ready to transfer. Without lifting, grab the gait belt with 2 hands and glide the patient to their destination. Each time you transfer, it will get easier, as you will get better at your individual technique. Let's look at a car transfer. It will depend on how close to your car seat you can get with the wheelchair as to which board will work best for your transfers. In most cases, the 40-inch Beasy Trans will work great. The 32-inch board may work in lower vehicles if you can get close to the seat. The 28-inch board may be too short for most cars, so you will need to assess that before transferring a patient. It can be very difficult to get the patient up close to the seat to maneuver a transfer if you are standing in between the door and the patient. Try transferring from in between the car and the back left wheelchair handle. Many SUVs are so high up that transferring with any transfer board would be unsafe, including Beasy transfer systems. Remember, you should not transfer with more than a 6-inch incline or decline. When you are ready to transfer and you have practiced without the patient, making sure the seat will not hit objects during the transfer, put the car seat all the way back. Lock the wheelchair brakes and place the board under the patient, leaving a small portion of the seat visible. Make sure that you have enough of each end of the board on each surface that it will not slip when pushed down. Remember, you can use your hand to lift their skin to get the board underneath. Now glide the patient from surface to surface. At first, a second assistant sits in the driver's seat, helping to guide the patient into position. And once the patient is safely in the car seat, you can remove the wheelchair, help the patient get their feet into the car, and then gently rock the board out from under the patient. Some patients tend to slide before the seat goes, especially if they're wearing slippery clothing. Use of a no-slip pad tucked between the patient and the seat can reduce slipping. Place the board under the patient first, and then tuck the no-slip pad in. If the seat is screwed on too tight, the seat may stick. You can turn your board upside down and slide the seat to the middle. Check to make sure the nut is tight, but not over tight. You should loosen it just enough that the seat is sliding back and forth easily. Many commodes and wheelchairs do not have armrests that come off or lift up. Getting around that situation can be difficult. You may need to try a few different angles with the wheelchair. Sometimes transferring directly across from the commode works well. The Beasy glider has a curved shape that can help get around stationary arms. Wheelchair cushions can also help when the wheelchair has a bar in the seat that makes the board unstable. By using a wheelchair cushion, the surface is level and more stable to complete the transfer. As the toilet is usually a hard surface, your transfer system may tend to slip or slide on it. By placing a no-slip pad around the seat, it should help eliminate slipping. Lift the seat, wrap the no-slip pad around it, and set the seat down to hold it in place. Test the board without a patient first to make sure the board is resting securely. Many people do not realize that the arms of their wheelchair come off. Some have a button on the front of the armrest that you can push and lift the arm up. Some have a button under the armrest toward the back of the wheelchair and another button on the front bar of the wheelchair. Push them both and the arm will lift off. If the arm of your wheelchair is not removable, the 1300 Beasy Glider curved shaped board can help get around that situation. This can also help transfers to and from stationary chairs and commodes. Some wheelchairs even have tilt-back handles on the back, which can help a lot when assisting a transfer into a car, because it allows you to bend over closer to the patient and give you more room to swing your arms into the car while transferring. Most wheelchairs have leg rests that are removable. There is usually a lever close to the front wheels on both sides of the wheelchair. If you press that, it will allow you to either swing the footrest out of the way or lift the footrest off. You may have to swing the footrest to the outside to be able to lift it off. Patients can often be afraid of new medical equipment, movement, or have a fear of falling. Patients with dementia or Alzheimer's disease may fear the movement of the board. One tip may be to not only have the patient wear a transfer belt while transferring, but have the caregiver wear one as well. This gives the patient a place to hang on to so they feel more secure while you are transferring them. However, do not let them hold on to your gait belt if you feel they would be able to pull you over. Having two assistants often makes the patient feel more comfortable. If the patient's fear is too great, discontinue use or ask for the guidance of their medical professional. Now you are ready to use Beasy Transfer Systems. Feel free to contact us with any questions or additional training. We are happy to help. All of our products are available on our website at beasyboards.com or through our authorized Beasy dealers. Thank you for choosing Beasy for your mobility needs.